Hi, I'm going to talk about adrenaline. Now, most of us that work in the emergency unit, the theater, or in the ICU or high care units will be familiar with using adrenaline as an infusion to augment the blood pressure in a patient that's in shock. And there's various inotropes that you can use, but I'm going to speak about adrenaline. And often we actually a bit bewildered by using it because we may not be familiar with the doses, and we often titrate the infusion according to the blood pressure, especially when we have an A line and we have invasive blood pressure monitoring. Now, the thing is, a lot of infusion pumps that are used throughout the world, like in resource stricken areas, don't have a software to calculate the dosage. So one needs to do it manually. And there's a nice formula which I'm going to share with you, whereby you can estimate the micrograms per kg per minute. And it's important to express adrenaline dosage in micrograms per kg per minute, because at 0.01 to 0.03 micrograms per kg per minute, it has predominantly beta effects. From 0.03 to 0.15 micrograms per kg per minute, it has increased alpha effects, and then from 0.15 to 0.3 micrograms per kg, it has predominantly alpha effects. So you may need more beta effects in a case where you want to augment the contractility and stroke volume, cardiac output, and then alpha effects if you want to increase your systemic vascular resistance, especially in cases of septic shock where there's vasodilation. That's the hallmark. So the thing is, if you want to estimate the dose as per micrograms per kg per minute, it's the moles per hour expressed on the syringe driver divided by the weight. And the way you get that is mathematics, pure mathematics. And that essentially involves uh, making up a solution of adrenaline, which is 60 mics per mole. And that involves using 3 amps of adrenaline in 50 moles to give you 60 milligrams in a liter, which is about 60 mics per mole. Now, if you calculate the maths, if it's moles divided by weight, you will get the mics per kg per minute, because when you try to estimate it, it's your moles times the strength of the solution divided by the, the minutes divided by the weight. Now, there's 60 mics and there's 60 minutes in an hour, so that cancels out, and that gives us moles per hour divided by the weight, which gives you mics per kg per minute. And now, if you are trying to target a specific mics per kg per minute, then you can simply just times the mics per kg per minute by the body weight to give you the moles per hour that you need to dial up. So that's a very interesting and very easy, simple way of calculating the moles you need to give and how much you are giving, because often we're titrating, we're increasing the moles per hour by pressing the button on the syringe driver, and then when we see that the specific infusion rate is appropriate in resulting in a specific desirable blood pressure, then you can now estimate how much it is in micrograms per kg per minute, and that will tell you whether the predominant effects are beta or whether the predominant effects are alpha.